Welcome to the Provincial Forensic Pathology Unit at the Ontario Forensic Pathology Service, home of the University of Toronto Forensic Pathology Residency Training Program. So forensic pathology is the application of science and medicine to questions of medical legal significance, and the principal role of a forensic pathologist, it depends on where you work in the world, because we have a myriad of hats that we wear depending on the jurisdiction. In Ontario, the principal duties that we perform are medical legal autopsies with the coroner system, but in other areas of the country, in places like Alberta or Nova Scotia, the forensic pathologist heads the entire death investigation system, in addition to performing autopsies, which most people are familiar with. When a person dies in the community and they're subject to a medical legal death investigation that involves an autopsy, their body's brought here to the facility. Downstairs we saw the autopsy bays where we perform our autopsy work. There's general bays, of which we have many, and there are several bays that are special autopsy bays that have higher airflow rates and physical controls on access, so that if there's a case that's either more sensitive or potentially involving an infectious agent, we would move into one of those bays to conduct the work. The storage facilities downstairs include large volume storage capacity in a refrigerated space, as well as secured storage for criminally suspicious and homicide cases. We have workflows available for identification of the deceased individuals. Identification is one of the most sensitive and important aspects of our job, ensuring that we know who the person is, who's died, and before we proceed any further with the autopsy. Sometimes an accident occurs on a roadway and the individual can't be removed from a vehicle. The extrication bay exists such that they can bring in a whole vehicle and perform a controlled extrication using heavy equipment to safely get those individuals' remains out in a dignified way. It also allows the roadway or public space where this occurred to be both released back to routine business, but also protecting the privacy and dignity of the individual who's died by taking that vehicle out of public view while the work is conducted. You also saw some of the advanced postmortem imaging modalities that we have downstairs, including a postmortem CT scanner and an MRI. These devices allow us to look inside the body without incisions and advance our ability to both document a body before an autopsy is performed and in perpetuity, but also potentially answer questions without using traditional incisions. So that's a facility that's available here that is not available currently at any other site in Canada. So histology for our unit here is all done on site. We have ultimate control over all of our quality for our histology, and our excellent team of histotechnologists are able to provide problem solving and solutions for us for any of our diagnostic histology service just right on site. Commonly, anybody who's not involved in direct evidence collection, such as the police photographers or forensic identification officers, are not present right in the autopsy suite with us. We have briefing areas where we can go into a room and speak with them directly, and then they observe from the other side of protected glass. Forensic pathology remains essential to modern healthcare. When questions remain, when someone dies, forensic pathology remains the gold standard for answering those important questions, whether it be related to standards of care or adequacy of care, whether it be related to any criminal matters that may have been involved in the person's death, or may it be related to public health and whether or not other individuals in the community are at risk.